Hello. Just want to teach you some really important stretches. See how my butt is totally against this wall. I have a big wall to put my feet on. And it's really key to keeping our hips in line, and our sciatica nerve, gets pinched by our piriformis muscle, which is in our hip, in our butt. And just stretching all these muscles, pulling, flexing, it's all really good. But this is really key. When you have hip pain, you sit a lot, you just have issues. It could also be magnesium deficiency. But see how I'm bending my knee on the wall? Yeah, you can feel that in your mid-back. You might feel it here. It's a good way to push really hard and push your back into the floor while you're doing it. It's a good way. It's like getting deep tissue, but not really. Just pushing, it just increases muscle strength in your lower back. This is really key. So your legs are like this, and then you move one over your knee, above your knee, and then with your feet, what's wrong with the camera? You start to push. You start to try to move your foot. Down like this. Except it's really hard for me to do that. We'll keep my butt and my sitting bones centered, because as you're pushing, your knee is pushing. Your other leg that's over your, my right leg is over my left knee right now. And just by inching, I'm stretching my piriformis. I'm stretching my thigh, my butt. Yeah. You just want to take deep breaths here. When you take your deep breaths and you breathe out, I want you to imagine your breath going to the place that has the most tension, which might possibly be your gluteus, lateralis muscles, and I don't know if that's an adductor or an abductor. Abductor? I think it's abductor or adductor. I always mix those up. And your piriformis and your tensor fasciae lata, IDT band, should all be getting a really good stretch here. The reason for this stretch is that muscles get they get shortened and they start to pull at other muscles, and in this situation your sciatica nerve and another nerve I think runs through your butt, and that'll make nerve pain happen. You don't really want nerve pain. Doesn't feel good. And so if you're sitting all the time and sitting, or you just are slouching, and you need to get some pressure on your mid-lower back and also on your butt, this is a really, really good exercise. I like to breathe in and out with the stretch. I'm just sort of almost push my leg into the wall and prepare for the same thing. See how this is moving, and then it's exercising my butt. It's getting the pains out of it. Sometimes I'll end I guess I'll just do it with you. up. Breathe out and stretch it up. Flex. Maybe go to the right and to the left and stretch those peroneals and tibialis and gastrocnemius. Everything that's like, all of your calf muscles, front and back. It's a really great stretch. If you're gonna, get up, just like slowly curl to the side. But I'm not getting up. I'm just repositioning the camera. I can just like really feel this in my lower back. But like my legs are stretching, so it's like my lower back hurts. Maybe I should stretch my legs. You can like, have something to hold on to or something, or like use your hands, or you want to use your core and just sort of like lift your legs up, bring them closer to you. Do anything it takes to use your like back and core muscles. You can even like make your feet go in and just sort of like rock around, be like silly rocking, or grab your big toes and put them up and just move from side to side. It's really nice having, the wall as a balancer. It's a really good stretches just to do. Maybe like if you're not used to doing yoga, to do these before you start going into like downward dog. Or just to like up your energy in the middle of a work day. Just take like a 15-minute break and allow yourself to be rolling around, holding your toes. It's okay to fall. Just allow your core and your glutes to like bring you back up to center. You can even do ones where you like put your leg over, or you put down, stretch. And you just like have your legs like past the wall. And you just like, there's a door right here, so I can just like lay this here and drag it and against the whole like outside here stretch. Kind of like pull back. And it's just like you're riding a bike. Anything to get it moving. Then you want to pull in with your knees and just get yourself to roll on your spine, the muscles around your spine, your erector spinae muscle. Just sort of like any kind of like wiggling on your spine while rolling is really healthy. You might get some natural cracks. You don't want really extensive cracking, just like enough because your muscles are stretching. And you're just getting a natural crack going. Just sort of like, you can like lock your elbows, so like this would be like I'm pulling in and rolling. This is really good for like your mid-back. But if you want to like pull your knees away just a little bit so that your elbows lock, and then roll.